Blepharitis. Introduction. Blepharitis is a chronic inflammatory condition affecting the eyelids, particularly at the base of the eyelashes. It is one of the most common ocular disorders and can cause irritation, redness, and discomfort. It is often associated with bacterial infections, skin conditions such as seborrheic dermatitis, or dysfunction of the meibomian glands. While not sight-threatening, untreated blepharitis can lead to complications such as dry eye syndrome and corneal damage. Definitions. According to the American Academy of Ophthalmology, AAO blepharitis is inflammation of the eyelids that leads to irritation, redness, and crusting around the eyelashes. According to the World Health Organization, WHO, a chronic inflammatory disorder of the eyelid margins caused by bacterial colonization, sebaceous gland dysfunction, or underlying dermatological conditions. Risk factors. Infectious factors. Bacterial colonization, Staphylococcus aureus, Staphylococcus epidermidis. Viral infections, herpes simplex, varicella zoster virus. Demodex mite infestation. Non-infectious factors. Meibomian gland dysfunction, MGD. Skin conditions, seborrheic dermatitis, rosacea, eczema, psoriasis. Ocular allergies. Environmental and lifestyle factors. Poor eyelid hygiene. Contact lens wear. Exposure to dust and pollutants. Use of expired or contaminated eye makeup. Hormonal imbalances. Etiology. Blepharitis is classified based on its underlying causes. Anterior blepharitis affects the front edge of the eyelids, usually caused by bacterial infections or seborrheic dermatitis. Posterior blepharitis results from meibomian gland dysfunction, leading to abnormal oil secretion and irritation. Mixed blepharitis, a combination of anterior and posterior blepharitis. Types. Staphylococcal blepharitis, caused by bacterial overgrowth leading to crust formation. Seborrheic blepharitis, linked to dandruff-like scaling and excessive oil production. Meibomian gland dysfunction, MGD, involves blockage of oil glands, leading to dry eye symptoms. Demodex blepharitis, caused by an overpopulation of Demodex mites at the base of the eyelashes. Pathophysiology. Bacterial or mite infestation. Colonization of eyelid margin by bacteria such as Staphylococcus or Demodex mites. Down arrow. Inflammatory response activation. Cytokine release and immune system reaction leading to swelling, redness, and irritation. Down arrow. Meibomian gland dysfunction. Blockage or abnormal secretion of oils, reducing tear film stability. Down arrow. Tear film instability and dry eye symptoms. Irritation, burning sensation, and excessive tearing. Down arrow. Formation of scales and crusts at the eyelid margin. Eyelash matting and thickened secretions. Down arrow. Potential corneal involvement and chronic eye discomfort, leading to complications such as corneal ulcers or conjunctivitis. Clinical manifestations. Eyelid redness and swelling. Itching and irritation. Burning or stinging sensation. Crusting and scaling around eyelashes. Watering or dry eyes. Sensitivity to light, photophobia. Blurred vision, due to tear film instability. Foreign body sensation in the eye. Lash abnormalities, misdirected, missing, or brittle eyelashes. Diagnostic evaluation. History taking. Onset and duration of symptoms. Associated conditions, dry eye, rosacea, dandruff, allergies. Eyelid hygiene practices and cosmetic use. Physical examination. Slit lamp examination to assess inflammation, scales, and oil gland function. Meibomian gland expression to check for blockages. Fluorescein staining to evaluate corneal involvement. Laboratory and imaging tests. Eyelid swab culture, to identify bacterial infection. Microscopic examination for Demodex mites. Medical management. Pharmacological management. Antibiotic ointments, erythromycin, bacitracin for bacterial infection. Oral antibiotics, doxycycline or azithromycin for severe cases. Anti-inflammatory drops, corticosteroids, short-term use to reduce swelling. Artificial tears, to relieve dry eye symptoms. Tea tree oil application, for Demodex mite infestation. Surgical management. Meibomian gland expression, manually unblocking the meibomian glands. Lid margin debridement, removing crusts and debris to enhance tear film function. Dietary management. Omega-3 fatty acids, fish, flax seeds, to support meibomian gland function. Hydration to maintain tear film stability. Anti-inflammatory foods, turmeric, green tea, to reduce chronic inflammation. Nursing management. 1. Risk for infection related to bacterial colonization and poor eyelid hygiene. Interventions. Educate the patient on proper eyelid hygiene, including daily cleansing with warm water and baby shampoo or lid scrubs. Encourage the use of warm compresses to loosen crusts and reduce bacterial buildup. Administer prescribed antibiotic ointments or drops as per the physician's instructions. Advise the patient to avoid rubbing their eyes to prevent worsening of the condition. Recommend replacing old eye makeup and avoiding the use of expired or contaminated cosmetics. 2. Risk for dry eye syndrome related to meibomian gland dysfunction and tear film instability. Interventions. Encourage the use of preservative-free artificial tears to maintain tear film stability. Teach the patient to perform regular warm compresses and gentle eyelid massage to improve oil secretion from the meibomian glands. Advise on increasing dietary intake of omega-3 fatty acids to support tear production. Educate on avoiding environmental triggers such as smoke, dust, and excessive screen time. 3. Impaired comfort related to eyelid irritation, itching, and foreign body sensation. Interventions. Apply prescribed anti-inflammatory eye drops or ointments to reduce inflammation and discomfort. Recommend the use of cool compresses to soothe irritation. Teach the patient to avoid touching or rubbing the eyes to prevent further irritation. Encourage hydration and proper nutrition to reduce systemic inflammation affecting the eyes. 4. Risk for corneal injury related to chronic eyelid inflammation and misdirected eyelashes. Interventions. Monitor for signs of corneal involvement, such as pain, photophobia, or vision changes. Educate on the importance of routine follow-up visits with an ophthalmologist to assess corneal health. Refer for surgical interventions like lash removal if misdirected eyelashes are causing corneal irritation. Advise against prolonged contact lens use and ensure proper lens hygiene. 5. Disturbed body image related to visible eyelid redness, crusting, and lash abnormalities. Interventions. Provide emotional support and reassurance about the treatability of the condition. Educate the patient about the chronic nature of blepharitis and the need for consistent management. Offer guidance on makeup alternatives that are safe for sensitive eyes. Encourage social interaction and counseling if self-esteem issues are present. Prevention. Good eyelid hygiene, regular cleansing with baby shampoo or specialized wipes. Avoiding contaminated cosmetics, replace eye makeup regularly. Managing skin conditions, proper treatment of dandruff, rosacea, or allergies. Warm compress application, helps unblock meibomian glands. Maintaining a healthy diet, omega-3 supplements for eye health. Regular eye checkups, early detection and management of symptoms. Complications. Chronic dry eye syndrome. Recurrent conjunctivitis. Corneal ulcers or scarring. Eyelash loss or misdirection. Formation of styes or chalazion. Permanent eyelid thickening and deformity. Conclusion. Blepharitis is a common yet chronic condition requiring consistent management. While it is not sight-threatening, untreated cases can lead to significant discomfort and complications. A combination of good hygiene practices, medical treatment, and lifestyle modifications is essential for long-term control and relief. Early diagnosis and preventive measures can significantly improve the quality of life for affected individuals.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.